On today's episode of Real Life Pharmacology, I'm going to cover alpha blockers. The most common alpha blockers I see used in clinical practice are doxazosin, Cardura, terazosin, Hytrin is brand name, prazosin, which is Minipress by brand name, and tamsulosin, which is Flomax by brand name. So with Flomax or tamsulosin, I do want to mention that this is a little more selective for bladder tissue. So that can be good or bad depending upon what we're trying to do. The two primary uses for alpha blockers are BPH. It kind of helps relax the smooth muscle and it eases the flow of urine out through the body and passing urine that way. And it does this by blocking alpha receptors. Alpha receptors, by blocking them, we cause a relaxation in that smooth muscle. And that works exactly the same way on blood vessels as well. So I did mention selectivity. So tamsulosin Flomax, you will not see used for management of hypertension. Now, the others are more non-selective. Doxazosin, terazosin, prazosin. Those are non-selective, and those can be used to help lower blood pressure. With that said, for the blood pressure lowering effects of those three agents I mentioned, the medications themselves tend to really cause some significant orthostasis or a drop in blood pressure upon position changes, and it can almost lead to syncope type effects where patients feel like they're basically passing out. So these agents are definitely not a first-line agent in the management of blood pressure, and that's really the primary reason that they aren't a first-line agent. Now, if you've got a patient with dual diagnoses of hypertension and maybe they have some urinary retention due to BPH, benign prostatic hypertrophy, then that might be a decent candidate to use an alpha blocker in. Now, I mentioned the tamsulosin being more selective for the prostate tissue and the urinary flow and managing urinary retention. Again, that's only used for that purpose typically. However, as we escalate doses, we may lose some of that selectivity. Normal doses are 0.4 milligrams or 0.8 milligrams with Flomax. As we get to the higher doses, or maybe in patients that are more sensitive, like the elderly, for example, we certainly may still see some of that drop in blood pressure and risk of orthostasis contributing to falls and dizziness and things like that. So those are the really main big side effects is that drop in blood pressure and dizziness associated with that as well. Now, rarely, and I have seen this come up on test questions and things like that before, it can contribute to what's called floppy iris syndrome, and that can happen in patients who have had eye surgeries and things like that. So these agents are kind of classically associated with a potential risk of floppy iris syndrome in patients undergoing eye surgeries. Now, when I talk about BPH and urinary retention, so important to recognize that these alpha blockers may tip you off to the prescribing cascade. The prescribing cascade, that's the situation where we use one drug to treat the side effects of another drug. So anticholinergics, strong medications that can impact BPH and actually worsen the symptoms of urinary retention and BPH. So if you see an alpha blocker added to a patient's regimen to help with BPH symptoms, also be sure to look and make sure that they aren't taking a medication like an anticholinergic. One other medication that I've commonly seen do this is chronic Sudafed or pseudoephedrine, which that has some alpha agonist activity. Remember, that directly opposes the alpha blocking activity. So stimulating those alpha receptors, like pseudoephedrine would do, could also worsen those symptoms of BPH. After the break here, I'm going to talk about one really unique use to prazosin. Are you a pharmacy student looking for help on your NAPLEX? Be sure to check out meded101.com/NAPLEX for a growing list of great resources, from webinars to practice exams to books available as well. Again, meded101.com/NAPLEX. Finishing up on alpha blockers here, I wanted to talk about one off-label use of prazosin that's really, really unique. And I've seen this occur in the psych world. So prazosin can actually be used and has some evidence to show that it can actually help reduce the significance of nightmares, often in relation to PTSD. Now, whenever we use an alpha blocker, we've got to think about the potential adverse consequences to using prazosin for nightmares, and that it can certainly drop blood pressure, which could lead to dizziness, fall risk, things like that. Oftentimes, prazosin is used in younger patients for these nightmares, but in the elderly, it may be a little bit more challenging to do that because it can really drop that blood pressure pretty significantly. So again, this medication can be used off-label for that purpose. Again, I've seen it probably most often in patients with PTSD that have significant nightmares and things like that. With nightmares, it's always important to look at other medications. I've definitely seen other psych medications contribute to nightmares and vivid dreams and things like that. Another classic example of a medication I've seen cause nightmares is Chantix or varenicline for smoking cessation as well. So important to remember that if you see prazosin being used for that purpose, to keep an eye out for drug side effects and other things that might contribute there. Hope you enjoyed today's episode of the Alpha Blockers here on Real Life Pharmacology. I've got some free giveaways that I give to subscribers, people who follow the blog, follow the podcast at reallifepharmacology.com. So certainly feel free to go ahead and check out those freebies. I think they're certainly advantageous to anyone studying pharmacology and trying to learn tricks of the trade. Thanks all for listening. Take care and have a great rest of your day.